You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, full mouth makeovers, full mouth reconstruction, as he calls it. He says, my first guest says that your teeth can never be too far gone. You could always have the smile you've always wanted. Also, on the second half of the show, sedation dentistry is the new thing that everybody seems to be taking advantage of, where you get lightly sedated, you wake up, and you have a beautiful smile. So with us we have Dr. Patel. Dr. Patel, welcome to the program.
Thank you, Randy.
All right, now for people that, and you brought photos, so we'll get to as many of those as we can.
Yeah, I appreciate that.
But for people that don't know your practice, who's the typical patient, and what are the different services you offer?
Sure. So, Randy, we're a general dental practice, and we offer a full range of dental procedures, from as simple as teeth whitening. You know, if someone just doesn't like the color of their teeth, maybe they like the alignment of their teeth, just want to kind of brighten them up a little bit, and we offer teeth whitening, to cosmetic dentistry. If someone is just unhappy with their smile, maybe their smile is worn down, chipping, breaking down, and they want to take years off their smile, make their smile look younger, we can offer cosmetic dentistry to them.
All right.
All the way to if someone's missing a single tooth or multiple teeth and are wanting to replace those teeth, we would offer dental implants to them. And another group of patients that we have are denture wearers who maybe are just tired of wearing dentures, or don't like the way they look, the way they fit. Maybe they're unable to chew what they want, and they've heard about a procedure where they can come in the office and get a full set of permanent teeth just in one visit.
So you do dental implants, so right there.
Correct, yeah, all in one day. And so they're literally walking out with a brand new smile.
Now today's topic is both sedation dentistry and you call it full mouth reconstruction. What is that?
So it's almost in a sense where we're rebuilding someone's whole mouth, in the sense that a lot of the patients, I'll give you an example. Patient comes in and she is just kind of at that point where she didn't know what to do. She was kind of felt like she was out of options, didn't know where to go, what to do, what the options were. She's just having multiple dental issues, a lot of tooth pain, a lot of chronic pain, and just in the situation where she's, again, just running out of options, not knowing what's possible, what's available. And within a few short visits, we're able to rebuild her smile, give her that smile. She was at a point where she couldn't eat what she wanted to. She would go to a restaurant and just avoid certain things on the menu because it would cause so much pain. And definitely it influenced her life on how much discomfort she was in and how embarrassed she was about her smile. And like I said, just within a few visits, we're able to restore her mouth, get her that smile she's always wanted, and rebuild her bite and get her chewing comfortably, smiling more, and just living a better life.
So people can't be too far gone. What if you have bad gums?
Can
you still give them like veneers or dental implants or whatever?
Yeah. I mean, we can definitely work on getting the gums healthier with some gum therapy. Yeah, they're never too far gone, for sure. There's always a solution that we can provide.
Okay, sedation.
Sedation.
You're big on sedation. You love it.
For our patients, yes. Because there's so many, we have such a big group of patients who are just extreme. It could be anywhere from they're just mildly anxious about visiting the dentist, where they just maybe need just a little bit of laughing gas just to help kind of take the edge off so they can get through their appointment.
Yeah.
And they're good to go back to work after that. Or up until where we can prescribe them a pill that they take that makes them extremely sleepy. And those are more for the patients who are just deathly afraid of the dentist. They've put off going to the dentist because of this fear. Maybe they've had a past negative dental experience or trauma growing up going to the dentist, and they just are having difficulty overcoming that. And they're wanting to get their work done. They're wanting to improve their smile. They're wanting to fix their teeth, but that's a big barrier for them. So sedation dentistry definitely removes that barrier, so they're able to get more and more dentistry done. And so we also offer IV sedation, and we're able to do years worth of dentistry just within a one to two visits. And another group of patients we have that prefer sedation is the type A busy individual who just doesn't have time to come back and forth for all these dental visits, has a busy schedule. Maybe they're traveling and they need to get a lot of work done in a short amount of time, and we're able to accommodate those patients.
Because nobody likes going to the dentist, right?
Nobody.
Do they tell you that, by the way?
Yeah.
Because you seem like such a nice guy, but nobody likes going to the dentist.
No, and we accept that.
Do they say that?
Yes, and we get that. And
do you have a comeback when they say, like, how do they say it? No offense?
Usually people are like, you're not my favorite person. I don't know you, but you're not my favorite person.
Really?
And I just say, like, we get that all the time, and that's normal. And but our goal is to change that experience for the patient, and just making them comfortable just in conversation up until if they need sedation to get them through their dental visits.
Let's take a look. You brought some photos.
Yes,
what are we looking at here?
Yeah. So I'll show you our first patient. She came to us with broken teeth, missing teeth, unhappy about her smile. So she noticed over time her teeth were chipping, wearing down, breaking. She's losing teeth. So it's this gradual progression. And she felt like she was at a point where she didn't know what to do. And so we were able to offer her a solution where we're able to restore her smile, rebuild her smile, and cleaned up her lower teeth. You don't see that in the photo. And you wait till you just see the after, because it's a pretty amazing transformation.
So you call this one a full mouth reconstruction?
We would say this is a full mouth, reconstruction.
Rebuilding the whole mouth.
Rebuilding the whole mouth, combination of different treatments, but a full mouth reconstruction. So look at the difference that has made. I mean, she's gone from yellow teeth, discolored teeth, gaps in her smile, to a more youthful, just more appealing smile. You can see how, to mention it, the artistry involved. This isn't just cosmetic dentistry. It's full mouth functional dentistry where she can chew and eat comfortably. You can see how the lower lip line follows the edges of her teeth. The color complements her skin tone. The shape of her teeth matches kind of like the overall shape of her face. So there's a lot of artistry as well as function in there. So those aren't veneers. This is a combination of dental implants. I mean, again, just look at that transformation. What a great result. A lot of times when we do these cases, it's such a dramatic transformation in such a positive way that when we're in the room and we sit the patient up, we give them that mirror for them to view their new smile at that time. I mean, it literally is just witnessing a transformation in front of your eyes. And literally, a lot of times there's tears coming down. When the spouse comes in, they're getting all choked up. And it's just a really emotional, positive experience. And it just literally is life transforming.
Now, with sedation dentistry, this is a person that was sedated?
Correct, yeah. Again, like we had mentioned, not everyone is excited to go to the dentist. And then not everyone is excited to go to the dentist when they understand that they need a fair amount of work to be done.
Okay.
So sedation dentistry, like I said, removes that barrier. She came in, we gave her some oral sedation. She became sleepy, slept through the procedure. And when it's all done and said, these patients are generally after sedation dentistry, they're like, the time is lapsed for them. So they're like, was that like 5 or 10 minutes? And then they literally have been there for hours.
Is that right?
Yeah, and
is it easier for you when you're doing sedation dentistry on somebody?
Generally, it can be. The more
they're relaxed.
Yeah, the more comfortable our patients are, the more comfortable we are. We don't like inflicting discomfort upon anyone. We want to make sure they're comfortable, they're in the best state. And it just generally makes things go smoother when they're comfortable. Maybe they're listening to music. Maybe they're having some oral sedation. They're kind of in a different place where they can just relax. We'll worry about the dentistry and give them an awesome result in the end.
Okay, good.
Yeah. Check out this one. And again, this is another one where, again, you're just going to be blown away by the results.
By the after, okay.
By the after. Again, patient comes in. She actually was wearing a removable partial. You can kind of see the clasp in the upper right side. The metal clasp, and it was actually replacing her front 2 teeth. And she had so much patchwork dentistry done over the years. She had crowns, she had a partial, she had fillings, she had missing teeth. She's had root canal, so you name it, she's had so much done over time. And she just, even with all that work, she just still never really liked the way her teeth looked. And the fact that something was removable was not very comfortable in public settings, out at restaurants, in front of friends. If that ever came loose during a meal, I mean, that was a source of embarrassment for her.
All right.
And so we were able to offer her a more permanent solution. But yeah, check this out. I mean, huge. It looks like a whole different person. Smile line looks better. Her old teeth came down quite a bit where you barely even saw her lower teeth. We were able to raise those teeth up with the appearance of raising them up. Built out her smile. Her teeth were, one thing about a nice, pretty smile, we want the lower lip to kind of follow the edges.
Okay.
We want to build out the corners of the smile to kind of give that Julia Roberts effect of that nice, broad smile. In her before picture, her teeth were kind of compressed in. We're able to build them out more. The color, she never liked the color of her teeth. Very light in complexion, so we're able to go white with the teeth, where it's not so much of a contrast. And the before picture, she looks, people with teeth like this, they look older. They can be prejudged. They can kind of be discriminating in the sense that sometimes they look older. They don't look as healthy.
Like they look poor. People with bad teeth, you
exactly.
assume they're poor.
Exactly. Yeah.
And they may just be afraid of the dentist.
Exactly. I mean, even if you look
Is
at
that right?
Yeah. Even if you look in Hollywood movies, right? Like if someone's going to go play a role of an older individual, one of the first things they do is darken their teeth.
Yeah.
If someone's going to play either a villain or someone who's poor, they tend to darken the teeth and make them crowded together. And so that carries across. And when teeth are straighter, when they're whiter, it naturally brings out like a youthful appearance. Naturally brings out like a certain charisma to these patients. And I can tell you, this is literally, again, same thing. So, I mean, this case is actually very complicated, Randy, and not to bore you with the details, but I mean, we had to do, we're doing dental implants, we're doing fixed crowns, we're doing fixed bridges, we're straightening teeth, we're maybe removing some of the bad ones. So definitely different facets of what needed to go on in order to get that final perfect result for her. But the end result, she had something removable at the very beginning. Now she has everything that's set in place. She doesn't have to remove anything at all. Everything's permanent, and everything's just a great solution.
Now you say that they change. You change their smile, and it like changes their life.
Definitely.
You believe that?
Oh, absolutely. I mean, when say for example, she went around, just not being happy with her smile, and so she would actually kind of hide behind her smile. She wouldn't show her smile, and literally, it's like a different person who comes in the office after
it's all done.
Oh, after it's all done. They're chatting it up. They're going on all these vacations. Maybe wearing more makeup. Their wardrobes have changed.
Well,
I mean, it definitely is a.
Now you're a dentist.
Yes.
I'm sorry to interrupt, but you think the smile is probably one of the most important things.
Okay, as a dentist, I do, but let's take me out of the equation. Okay. If you look at any survey, say Gallup. Men's Fitness, Glamour, and they ask, like, what do you find the most attractive about a potential spouse or partner? Within the top three, the smile is always up there. Maybe it's eyes, maybe it's the smile, maybe it's their outlook towards life.
That's definitely true. Smile's always
definitely
there.
the smile is up there. Look at ourselves. Like when we present ourselves to other people, 85% of our bodies are covered, but the smile is front and center. Front and center. It's we like to say it's like prime real estate, on your face. And so again, not only as a dentist, but say for example you're interviewing two people for a job position.
For a job, okay.
And they both come in and they're twins. And they had the same educational background, same work experience. And one comes in and they're kind of talking very, very timidly, maybe covering their smile with their lip. The other one is a little bit more animated, talking and smiling at the same time. Who would you be more likely
you hire
to kind of,
the one that looks happier, enthusiastic.
Exactly.
So there's a lot of people like that.
Oh, a lot of people.
And so
like
sedation, because for people just tuning in, we're talking about don't let your fear of the dentist or your excuse that you're too busy. You go in, you can take a pill, and get all your dentistry done and walk out with a beautiful smile.
Definitely.
Is that an overstatement, or does that actually happen?
That can happen. Yeah, that does happen. Yeah. Consistently, yes, yeah. We were known for tackling these complicated cases, dealing with a lot of the patients who.
And this is your training, as you call it, full mouth reconstruction.
Correct. Yeah. Okay. And a lot of these patients, they just feel like they're at the end of the road, like they don't know where to go, they don't know what their options are, and we're able to accomplish a lot of dentistry in a few visits and get them that smile that they've always wanted. So this patient comes into our office and just is. Firstly, just displeased about his smile, just doesn't like his smile. Very happy individual, but just doesn't feel like his smile reflects his true personality.
Okay.
A little bit about his dental history. Had a history of a trauma, a car accident, lost some teeth. He was actually wearing something removable to replace some of his lower teeth. Always had that issue of it never fitting right, never feeling right. Cosmetically, he had a history of gum disease. Teeth are kind of starting to separate. You're noticing gaps between the teeth. Never liked the color of his teeth. Gums are kind of bleeding, irritated. There's gum infection. So lots of different issues going on.
When they come in on the consult with you, do you ever get excited? Like you're looking at this guy going, this is going to be good. Does that ever happen?
It does, yeah. Because I mean, we've done so many of these transformations where I do feel like and credit to my team, we tend to see the end vision. And to see that when a person first comes in, it's a cool experience. And we try to explain to them how this can be life transforming, show them before and afters as they're coming in. But yeah, with him, I knew it was going to be.
So what did you do for him?
So we were able to do so much for him actually, and we were able to place dental implants to replace some of his missing teeth. Where like I said, he had something removable before, so he never had to deal with that again. And we're able to get him a full set of permanent teeth that just look amazing. Like look at this after.
Looks like a different guy.
Different guy, yeah. And he's actually a TV personality. He wanted to go, nice broad white smile. He's on camera a lot, and I can tell you, like, life transforming. So his confidence level has just skyrocketed through the roof. I mean, he walks in, his charisma, his true personality is coming out. I mean, look at that transformation, that before and after. I mean,
he looks good.
I mean, he looks amazing. I mean, his teeth, they're uniform in shape. There's no gaps. There's nothing removable for him. I mean, he just looks fantastic.
Is this one of those things where they wish they would have done it years ago?
Oh, absolutely.
And did he get sedation?
He did get sedation.
Most of these people
to
sedated?
get him comfortable. And one thing I didn't mention is, he did mention that he had a history. I mean, he had a history of going to the dentist and he had been to the dentist. So he had a partial, he had crowns, he had root canals. So it's not like he never went to the dentist at all. So he had been going through the dentist years and years of dental work. A lot of money. And actually he was in a state of where he was just uncomfortable, just a lot of tooth pain, dental infection, and so forth. So now he's at a point where, I mean, he could chew and eat whatever he wants. He doesn't have to worry about that next toothache. He doesn't have to worry about that next tooth breaking off on vacation. And he's just in so much of a better place. And then charisma, I mean, he's exuding charisma. He's just like lighting up rooms when he walks into it. I mean, he is just looking fantastic and feeling fantastic. So patient comes in, again, history, he had a history of always going to the dentist. I mean, he had crowns done, he had root canals done, they were breaking down over time, and he just got to a point where he's missing teeth and almost felt like he was too far gone. And we're able to get him definitely taken care of, improve his smile. We did some dental implants to replace some of those missing teeth, rebuilt, basically did full mouth reconstruction. And he went from a spot to where he's not chewing certain foods, he's not eating certain things, he's hiding behind the smile. He's not very happy about his smile. Very outgoing, very, very just, personable person, but definitely you could tell was more reserved because they weren't as happy about their smile.
Let's take a look at the after.
Yeah, and just look at this after. I mean, just pretty amazing result. Going from people like that who have teeth like that in the pre-op visit or in the pre-op picture. I mean, again, they could be judged. I mean, look at them. They don't smile. They don't smile.
I never see teeth like this.
Yeah.
Is this
unusual? This is common for us. I mean, there's a lot of people who, again, and we had to do sedation dentistry with him because, again, that fear of, he had been to the dentist. He knew what it was like to get a root canal. He knew what it was like to get a crown. He knew what it was like to get all that stuff. But when you think like, man, I've got a mouthful of problems and I've already been through that once and I have to do that 20 times over to like fix these teeth, that definitely holds people back. And when we're able to just let them know, like, look, we're gonna do sedation, and it was literally just within a few visits, he's got this new smile, he's not having to go back and forth, and just really improve his life dramatically. So here's a patient. So this was one of a bigger projects that we had done, and we actually worked with a couple of specialists, and we were the final result. We were the final piece of this puzzle, and she worked with an oral surgeon, had some corrective jaw surgery completed. She was working with the orthodontist to help align the teeth, and we basically helped her get her bite better. She never liked the length of her teeth, which in the pre-op photo they were actually built up at this point.
Okay.
But she never liked the length of her teeth and the color of her teeth, and she felt like her teeth made her look older than she really was, and she never really smiled a lot. And she would get that a lot of people thought she was kind of like grumpy or not nice because of her not smiling.
Because she never smiled.
Yeah. But like, look at this, and this I'll tell you after, she can't stop smiling. Like I said, look, you can lipstick, wardrobe, hair, all these things are coming as a secondary to that smile. I mean, these are all things that are transforming, that gives that person that self-confidence, that charisma, that self-esteem, that, I mean, literally she can't stop smiling. So this basically defines what a full mouth reconstruction is. I mean, she was basically on the road of years and years of patchwork after patchwork, or replacement crown after replacement crown. And she basically needed her bite to be opened. Again, she was unhappy with the length of her teeth. Her teeth have been worn down from years of grinding and clenching. Her teeth were so small, and we were able to rebuild her bite, rebuild her teeth.
So she doesn't grind anymore?
Correct. Well, she's just in a better spot where, yes, she doesn't grind as much. And then we rebuilt her back teeth with crowns, did some veneers on her front teeth, and we're able to do a combination of restoring her bite as well as giving her that
Why is
pretty
the
smile.
bite so important? I mean, you bring it up all the time.
Yeah.
I know you're training over that Las Vegas Institute.
Yeah.
That's a big thing.
So it
Why
is
that so
important,
important?
because, I mean,
when you say bite, meaning the way teeth come together.
correct. So the bite is so important because say if we didn't incorporate the bite, or we didn't pay respect to the bite, like if she had just, say she went somewhere and just had cosmetic dentistry done, veneers, say veneers without working on her bite, then she'd probably be running into veneers breaking, chipping. Maybe she's getting migraine headaches because her bite's not settled, it's not balanced.
So you have
it's
to
not
address
even.
the back teeth
Correct.
when you do this.
Correct.
Okay.
Yes, it's not just putting pretty veneers on the front teeth, it's addressing the teeth in the back, looking at the big picture and comprehensively approaching it so she doesn't have future problems. Because once everything lines up, the bite's right, again, chewing is just way more comfortable.
Okay, so you fix the bites.
Correct.
So by definition, a full mouth reconstruction, you're getting the whole teeth to line up so it lasts.
Yes, correctly.
Okay.
Yeah.
And not all dentists, I mean, they don't teach this in dental school?
No. Again,
Like traditional dental school, general dentist, this is something you have to learn outside of dental school?
Exactly.
Is that right?
Yeah. So generally, I mean, when we go to dental school, I mean, it's a great education, but there's so much education that I feel that takes place afterwards, and especially with myself, just years and years of studying at, like, say, LVI and other institutes all over the world, just in order to learn from the best and to learn how to manage the bite, not just to do the cosmetics and so forth.
Sedation. Was she sedated?
Yes, just any procedure that's going to be that long, patients are going to be in the chair for that long. I usually say, hey, look, just to make everyone's life easier, we could do even if it's just light sedation, just to make them more comfortable throughout that procedure.
Tell me this, because I've met dentists and they say, Randy, my bedside manner or the way I talk to patients, they're comfortable. We don't need sedation. Do you think that's insensitive? Because I've had the sedation once, and I'm going, this is the only way to go.
Yeah. And even
So
if
I think they don't get it
Yeah.
by not offering sedation, because you have to have a special license, right?
Correct. Yeah. Certifications.
Certifications.
And so with sedation, again, like it could even just be offering nitrous oxide or laughing gas. And as basic as that, we have a group of patients who, even just for their cleanings, they just get so worked up or anxious because of.
So you offer that nitrous?
We offer nitrous.
Because I get that during a cleaning.
Yeah,
it's like the only way to go.
Yeah, just to make it easier. And so it could be nitrous, it could be light oral sedation, it could be IV sedation, just depending on where the patient's at. So
To take that edge off.
correct. Just to
Because
make
if
it
you
more
have to be there
comfortable.
for like 45 minutes, that's not easy.
Correct, yeah. Or imagine, if it's a few hours, then I definitely would say either light sedation or even IV sedation, just to kind of get the patient more comfortable.
So dental phobics or people that are in a rush, sedation's good for.
Correct, yeah.
Okay.
Yeah.
All right, time for a couple more.
Sure. Here's another patient. Her main concern was her teeth shifting. And due to a history of gum issues and gum disease and bone loss, bleeding gums, things like that, her teeth have kind of started to splay. And now she was noticing her teeth looking crooked and gaps between her teeth. And so basically we were able to, and as someone like people who fall into this category, people notice your smile, and young pretty girl, and definitely the smile didn't match with the rest of her, and so we were able to improve her smile. We did some dental implants. So look at the before and after, side by side. Such a huge difference. We had to do sedation dentistry. She was very anxious about getting all this work done, so we're able to accommodate that need and get her an awesome smile in the end.
Do people like this refer their friends?
Oh, absolutely. Yeah.
Or are they also very private about it? Like, obviously you have clearance to show these on TV.
Definitely.
But are people very private about
It
when
depends.
you do this kind of stuff?
I've got two camps. Some people are like, they'll tell the whole world about it, and some people are the opposite. That they just
tell everybody.
Yeah. And either way, whatever the patient's happy with, that's what we care about. And if they're if they're spreading the word, that's fine. But as long as they're confident, more confident, they love the results, that's all that matters to
So
us.
now, for most of the procedures, there's like maybe a specialist or 2 or 3 dentists involved.
Sure.
So you have this concept where you do it all right there.
Correct.
Is that right? I mean, you have your own CT scan.
We have our own 3D cone beam scan that, this is just like literally like I've had patients just say after we show them the scan, they're like, I have literally never seen anything like that before. It's their whole, jaw, either upper and lower jaw.
Does it just help you do things more precisely?
Oh, it helps us do, dental implants, for example. They could be way more precise because we're basically able to guide exactly where we want that implant in relation to the bone and in relation to other anatomical structures. It helps with diagnosis of, what's going on. I've got this toothache. I don't know what's going on. Maybe I had a root canal. Is it fractured? And we're able to vividly see that. 3D imaging, it definitely helps us. It just makes everything just so more accurate, and it basically helps save the patient much more time because we're not guessing what's going on. So here's another patient, and came in missing the front tooth, had trauma to his front tooth, and he basically wanted to get a better smile. But we told him, like, look, we have to work on the bite. The bite was off. We had to work on rebuilding the back teeth with crowns. And then we were able to give him that smile that he always wanted.
So if you don't rebuild those back teeth, help me understand why that's so important.
So if we don't rebuild the back teeth, the front teeth get more pressure. And if that's where the veneers or the cosmetic work is, then if they get more pressure and it's not balanced out, they'll tend to break or chip or be uncomfortable chewing with and so forth. So
that's why this whole full mouth dentistry, you call it full mouth reconstruction, is very important. Okay.
Yes.
But all the patient matters, to the patient, they go in with horrible teeth, get sedated, they leave with great teeth.
Exactly.
Is that right?
Yes.
Is that an oversimplification?
No, not at all, not at all.
Okay.
Yeah.
We are out of time. Final message, though, to somebody watching this, because we've talked about this full mouth reconstruction and sedation, but to the person that hasn't been to the dentist in 20 years, 10 years, or maybe they're just dental phobics, they're afraid. What do you say to them?
So I would let them know that, with sedation dentistry, and just, if they feel like their mouth's a mess, they don't know where to go, they don't know what to do, with sedation dentistry, we could do literally years worth of dentistry in just a few visits. If they feel like they don't have the time to do it, sedation's great for patients like that because, again, we're able to do so much in such few
in a
visits.
short period of time.
Yeah.
So if a woman has like 3 kids at home, right?
Yeah.
She can't afford to make a bunch of trips to the
Exactly.
So what you're saying is you could get them there like 3 or 4 hours, do a bunch of stuff.
Exactly. And
where they normally couldn't tolerate it because they weren't sedated.
Yeah, and we're equipped to do that. We're equipped to accommodate all of those needs, for sure, yeah.
All right. So I want to thank you for coming on the show.
Yeah.
Great stuff. And they can go to your website, see the photos.
Definitely.
All right. Thanks again.
Awesome. Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.